Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to my YouTube channel, Dr. Arslan Isaac. This is me, Dr. Arslan Isaac, and here is
I'm Dr. Hafiz Mohammad Hassan Makul from third year medical student MBBS, Mayuddin Islamic Medical College, Mirpur, Azad, Kashmir.
today we are here to discuss about the medical profession, that what is the future of medical profession, and there's also AI system which
Yes.
comes in the future. So we'll discuss about this, like, and also there are some questions which are related to the medical profession, and inshallah we'll try to level our best and let's talk. Assalamu alaikum.
Walaikum salam.
How are you?
I'm fine, Alhamdulillah. And what about you?
I'm also fine.
That's excellent.
Okay. How you feel today? Today you are here in front of camera, in front of all fans.
I'm
What
feeling a bit nervous because I don't have experience of these particular things,
podcast?
these sort of podcasts.
Okay.
That's why I am a bit nervous, but I will talk, inshallah, confidently.
Okay, try the key of success. So inshallah we'll go ahead on this.
Yes.
Okay, Dr. Saab, why you choose this medical field? Is it over? You think that medical field is everything and you become blind?
I think MBBS is such a noble profession to have.
Mhm.
It has so much benefits. Being a good financial profession in the future, you can have a proper professional financial profession in your future life.
Yeah.
This is one of the advantages. The other advantage is from the girl side. Girls have that thing in their mind that they will have a perfect partner in the future by choosing this profession, this medical profession. But keeping all of these things aside, keeping the money, keeping the ego, all things aside,
Yeah.
we can say that it is such a beautiful profession when you see your patients recovering from a particular disease or certain kinds of traumas they had faced in their future, their past lives.
Yeah.
Seeing them recovering from those things is such a kind of boost, such a kind of inner peace that you feel. That is actually you feel from the medical profession. That's why I choose this profession because I can profession.
What's about your feelings now? You are present, still standing in the Mahidin Medical College in third year. So what about your feelings? How you feel that I'm a doctor and I want to do this, I want to do this?
Being a medical professionalist, I think that being a medical student is such a good experience. You haven't find that kind of experience before.
Mhm.
So learning good skills and seeing the patients in the hospital really really a kind of booster for you in your future life. You can diagnose on the basis of their signs and symptoms, so that will help you in the future perspective.
Okay, I'm impressed. What do you think about the future of medical profession?
Medical
Because
students, medical profession,
medical
medical
profession,
students,
also medical,
profession, overall profession.
yeah, that what is the future of medical profession? Because there's also modern technology which are grow rapidly,
Yes.
just like AI. Then what do you recommend for a AI and medical profession?
I
Is
think
that it replace the medical MBBS student? Because just MBBS students writes medicines to do this and he make diagnose and surgery. According to my point of view, that if AI comes in the future, then the concept of medical student will be vanished. Just the little concept is that a medical student do surgery or do diagnose or do nothing. Because another work of nurse, work of writing medicines can do a robot. So what do you think about it?
I can say that the AI, the artificial intelligence, is such a good thing to have in
Yeah.
our future, in our present. That is helping us to accomplish those kinds of things that were not present in our past. It is actually helping the medical profession at that moment.
Yeah.
I cannot totally agree with your concept. What is actually you are thinking about? Um, I don't think that AI is going to replace the medical profession or a medical student, a medical doctor
Yeah.
in the future, because the diagnosis, the treatment, the signs and symptoms of a doctor can understand will not be able to understood by the artificial intelligence.
Yeah.
For example, if you chrome your signs and symptoms or on chrome, the chrome will give you the diagnostic values that will give you the disease that is actually not present in you. After knowing about that kind of disease, you may get depressed, or it may prescribe you with such medicines that you are not requiring at that moment. This may cause toxicity or some other health damages, health bad effects. So I can say that having a medical professionalist
Yeah.
as a doctor is a good thing, and AI is also a good thing that is helping the medical profession, and it is actually not against the medical profession or harming
Yeah.
any kind of.
Oh,
And I don't think that it will be improving.
okay. Um, right. Being a doctor, I can understand
Yes.
your ideology. Okay. Which kind of advice you want to give me and also my fans? Because I'm studying in first year MBBS student and he is my senior third year. So which type of advice you want to give me first?
Being a senior, I
Yeah.
can advise
Avoid
you.
from girls. Yeah. Is it right?
I can't say anything about that.
Yeah.
I can advise you to be a punctual student, be a good student, and develop some good symptomatic techniques from right onwards. You should stay on your proper books. That in a first year MBBS you should be studying on the Guyton for physiology,
Mhm.
and the Langman embryology, Snell maybe or BD Churasia for your anatomy.
Yeah.
And for biochemistry you can use the Lippencourt. That is a good book to have. And for the first year and second year in Wahidin Islamic Medical College, you should also be study on from Mustaq Ahmad volume 1 and volume 2.
Yeah.
Because our teacher, Professor Nakib Ahmad Saab, um, like the person that has studied from the Mustaq book, because that are some kinds of advices.
Would you like to see on just a screen?
Yes.
Screen talk on this.
Yes.
Okay, what kind of advice you want to give them? I think this advice is also for them.
Yes, I actually gave those kind of advices to Dr. Arslan. It is actually for all of you guys. Reference books, not on the short books.
Okay, may I ask a question about your personal life?
Yes, and I think that should be your last question, because after that I want to ask you some questions.
But I'm not ready for your question.
But I but I
Okay.
have to ask you.
Okay, so let's do it.
The first question is on its way. The
Yeah.
first question is about again, why did you choose MBBS and what are your future perspectives?
I choose this medical field because of my sister. Because my sister is also a doctor and my father is also a doctor.
Okay.
Being this family, I think that that was a good chance to groom myself to take a high post just like MBBS because my sister is
Such a good thing
nurse.
to have.
Yeah, my sister is which is older than me. She's nurse and my father actually is VVM. So I think this is good for me.
So moving on to the next question.
I'm ready.
What are your but tell me about your schedule in the Ramzan, and what should what should be the things that needs to be changed?
I think it is a very difficult question for me because I don't study anymore. Due to Ramadan, it's very difficult to study, but I still study 4 to 6, 4 p.m. to 6 p.m.
Yes.
in 2 hours, and also from 8 p.m. to or 9 p.m. to 11. That's my schedule, but sometimes I don't follow it because of some type of depression, sometimes type of another activity. So for this way, this is my schedule. That's it.
Moving on to the last question. What kind of advice
What kind of advice? Yeah.
do you want to take from me, or
What kind of advice I want to give
you
you?
can't. What kind of advice that actually you are having and you want to express, you want to deliver, you can say.
Um, I have too many advices for you and for my audience also.
Yes, being
That
a medical profession, you can take advice from anyone, because till death you are a student.
yeah,
And
absolutely.
you can have the knowledge from any person. You can have any kind of advice from any person. It takes You can take
Yeah.
that is
The
good.
first advice is that learn daily basis.
Yes, good thing.
It may be two words, it may be a sentence,
Yes.
it may be a moral ethics a talk. Okay, learn daily basis. You have to learn one thing,
Yes,
and you should add it in your personality.
that is also a good thing to
Yeah,
have.
this is my habit, and I follow this since 1 year. And another advice is that be positive. When you're present in your class, when you're present in front of your ladies, in front of your gentlemen, be positive. And this positivity,
I think you are telling about the confidence. You
no,
should
I'm not. I'm talking about the positive thinking,
positiveness in
positiveness.
your
Yeah,
character.
and
That
the
is actually good.
yeah,
Good thing
and
to
the
have.
last one is that um, be aware and be away from the girls
Yes.
because you didn't take any respect when you follow them. If you want to take a respect, you follow my schedule, learn daily basis, and be positive. Okay, this is main points and numbers.
Being a Hafiz Quran,
Yeah,
I can say that I am happy to be away from
mashallah.
from that thing, that particular thing.
Yeah, keeping eyes down is a sign of confidence, and there's also present in Quran that when you see a woman,
Yes.
then keep your eyes down.
Keep your
It's
eyes down.
also nice. And there's when you give a presentation or when you comes in a stage, Then what do you think about the confidence, and what do you think about the personality, how to groom, how to
Yes,
give presentation something?
during presenting a certain topic,
Yeah.
I should say that the first thing you should keep in your mind that the topic that you are presenting, you should have a full grip on that topic.
Excellent. Yeah.
When you have grip on that topic, you
Yeah.
should forget about who are sitting in front of you, who are uh, listening to you. You should think that I have prepared the topic, I know better
About this.
and I can deliver the things that I know better than them.
Yeah.
So you will build your inner confidence. That will help. And you should keep an eye on each and every student, and after that you should present with full confidence, with
Okay.
your proper hand-eye coordination, proper body language movements. You can properly deliver your presentation, whatever it is.
Okay. The last advice is that keep
I
smile.
think I think
Yeah.
I was asking there is some questions for
Yeah.
me, not you.
Okay. Okay. I
No
want to
problem.
give a last advice
No problem.
that keep smile on your face always.
Yes.
Because I have a poetry in Urdu. You may understand. कभी थक के सो गए हम, कभी रात भर न सोए, कभी
Wow.
हंस के मुंह छुपाए, कभी मुंह छुपा के रोए, मेरी दास्तान हसरत वो सुना सुना के रोए, मुझे आजमाने वाले आजमा के रोए, मैं हूँ वतन बेमुसाफिर, मेरा नाम बेबसी है,
जबरदस्त.
मेरा कोई भी नहीं है जो गले लगा के रोए.
I,
क्या बात.
that's all from our side today, and
Okay.
hope you enjoyed the complete podcast. I should say podcast
Yeah, okay.
or whatever it is.
Yeah, okay. Allah Hafiz.
Allah Hafiz.